Hi and welcome to this video where you will meet your shoulder joints. Now as dancers we're always using our arms in choreographic motions, but we also in some styles might be doing weight bearing work on the arms, or we might be lifting and partnering other dancers. So this is when the highly flexible shoulder joint is being asked to do a weight-bearing task for which it isn't really optimally designed. So it's key to understand the underlying anatomy of the shoulder so that we can get the most out of our shoulders while keeping them safe. So let's have a look at the anatomy here. The shoulder blade. The fancy name for it is the scapula. Now this is the triangular shaped bone that sits on the back of the rib cage and really forms the basis, the foundation for our arm movements. The view you're seeing here is of the front view of your shoulder blade, as if you were looking through the body at someone's left shoulder. And you'll see on the outside edge, highlighted in red, there is a little depression there, a little cup, and this is known as the glenoid cavity. The glenoid cavity is the socket into which the top of your arm bone will fit. So this is a ball and socket joint, just like the hip joint, for instance. However, what you'll notice if you've already watched the hip joint video, you'll notice that the cup here of this glenoid cavity is very shallow. That means it allows for a large range of movement of the arm in that socket. However, remember, anything that's very flexible is inherently unstable. Now we've got a couple of other landmarks to look at here. That topmost bit that sticks out towards the side, this is known as the acromion process, and it's the bit that you can feel that sticks out on the top of your shoulder most towards the side here. There's also another prominence that points forwards, and you can just see that here, this other little hook of bone, and this is called the coracoid process. You can find this if you press into the area just in front of your armpit, just inside the top of your arm bone, and there's a little bony prominence there that points forwards, and it serves as an attachment point for some muscles which we'll look at a little later. Now I'm going to set this spinning now, and you can start to see 3D what's going on here. Now at the back you'll see that that acromion swoops down and becomes a sort of bony ridge that runs across the whole of the back of the shoulder blade, across in a horizontal alignment. And this is known as the spine of the scapula because it forms like a spine-like ridge across the back. Again, you can find this by pressing into the top of your shoulder blade, and you'll find it has this little seam of bone that tracks across the top of it. And this is an important point when we start looking at where the muscles attach around the shoulder blade. But there are some of the bony landmarks of your scapula or shoulder blade. So now let's have a look at some other bones that form the joints around the shoulder. The upper arm bone is known as the humerus, and it has a round head on it, a bit like the thigh bone that you looked at in the hip video. And that round head of the humerus is received into that glenoid cavity. And where those two bones meet, we call it the glenohumeral joint, or the GH joint for short. So that's really the main shoulder joint that provides a lot of the movement that we're doing when we're moving our arm in space, and it can almost give us that 3D movement, front, side, back, and we can circle it around. The shoulder blade, the scapula, we've already looked at, but we've also got the collarbone, known as the clavicle. And you can find this by, if you find those two bony lumps just at the top of your breastbone or sternum, that's the start of the collarbones, and you can track and walk your fingers outwards, and what you'll find is at the far end there's a rounded part of the collarbone that meets that acromion that we already looked at. And where those two meet, it's called the acromioclavicular joint. So these long names actually make sense when you know what the bones are called. We shorten that to the AC joint. So those are the two main joints that make up the shoulder. The glenohumeral joint, where your arm bone meets the socket on the shoulder blade, and then the AC joint, where the clavicle and the acromion process of the shoulder blade meet on the top of the shoulder joint. Moving on to other structures, we all know already, if you've watched the Meet Your Soft Tissues video, that ligaments are the structures that connect bones to bones at joints. So because we've got quite a complex arrangement of bones here, we've got quite a complex arrangement of ligaments. You don't need to know all the names of these ligaments. I've put them here in case you're interested to go that deep. But really it's just to understand that these bones require these soft tissue straps to hold and provide what's called the passive stability. So they just keep those bones held together, but they're soft, so they allow for motion, so we can get that big range of motion we have at the shoulder, but they're going to restrict you from pushing too far. There's also a capsule around the glenohumeral joint there that is formed by these ligamentous structures blending into a membrane-like structure that forms the capsule, because in that joint we have fluid. It's called our synovial fluid that helps to grease and oil the shoulder movements. If anyone's ever had frozen shoulder, that's an issue with the consistency of that synovial fluid. What we also have around the joint here, we have structures called bursae. A bursa is one, bursae is the plural term. Around the shoulder, we have several of these bursae. They reduce the friction in the area, particularly as we'll see later where we've got tendons rubbing across joints during movement, and help provide the cushioning around these structures. These can also get inflamed, and we can get something called bursitis if we get inflammation of these little fluid sacs. And the one in particular here, called the subacromial bursa, is one that can get irritated, particularly if we're doing a lot of movements with the arm above the head, or in like that sort of handstand weight-bearing motion. It can pinch on that bursa and cause an inflammation. But I'll do a separate video on subacromial bursitis. Let's move on now to some of the muscles. Now, because this shoulder is highly mobile, there are a lot of muscles to look at. Remember that muscles don't just have one job in the body, and these muscles will often pop up in other videos talking about other types of movement. But all of the muscles we'll talk about here have some sort of action upon shoulder movement, and we need to be mindful of them when looking at stabilising and strengthening our shoulder movements. So back view of the body, we have the trapezius. So this is the most superficial or nearest the surface muscle. And people are often familiar with those upper trapezius fibres because they're the ones that get a little achy around the top part of our shoulder. And you can see that they run from the base of the skull there, down across the neck, and then swoop outwards across the shoulder area. And those upper fibres are the ones that shrug our shoulders or help to lift those shoulders up towards the ears. Then we have the middle fibres. So remember, trapezius comes from the word trapezoid because the whole of this muscle creates a trapezius shape, which is like a diamond essentially. The middle fibres of which go horizontally from the shoulder blade across to the spine, and so they're more involved in pinching the shoulder blades together. So if you squeeze your shoulder blades together at the back, those middle fibres are more active. The lower trapezius fibres, you can see they come in this triangular formation from lower down in the spine and fan out across the lower part of the shoulder blade. These are really key in anchoring the shoulder blade downwards. So if you draw your shoulder blades down, my favourite phrase is put your shoulder blades in your back pockets, slide them down your back. Those lower trapezius fibres are active in that, and that's really important, not only for our arm movements, but also for things like arabesque, lifting the leg at the back. It's really key that we've got those lower trapezius muscles nicely fired up. On the right of the picture here, we've got a muscle called the serratus anterior. If you think of a serrated knife or a serrated blade, it has jagged edges, and that's why this muscle has this name. It starts on the underside of your shoulder blade, between the shoulder blade and the ribs, and it comes around and attaches into the rib cage. So this is how we start to see how our breathing is also connected to our shoulder movement. But this muscle serves to help stabilize that scapula down, again, particularly if we're doing weight bearing on the arms or lifting, but it also draws the shoulder blade around towards the front. Now let's look at some paired groups of muscles. Remember, muscles typically work in paired groups, and we need to have balance between these paired groups in order to stabilize the joint they cross. On the front of the body, we have the pectoral muscles. We call them the pecs for short. And there are two layers of pec muscle. And in this image here, we're seeing on the left the most superficial layer, the layer nearest the surface, and this is known as the pectoralis major. And it runs from the breastbone, the sternum there, and it comes across and it actually attaches onto that upper arm, the humerus. So if you think of rolling your arms inwards and pulling your arms in towards the body, the pec major would be involved in that movement. We call that adduction, where we add the arm towards the body. If we look underneath that pec major muscle, there is a smaller one called the pec minor, and you see on the right half of that image where the pec major has been taken away, you see this smaller fan-shaped muscle, and it starts on that coracoid process. If you remember that little knobble that sticks forwards from the shoulder blade, the pec minor muscle is attaching onto that and then fanning down to some of those upper ribs. If you round your shoulders, then you are shortening and contracting that pec minor muscle. So together they bring the shoulders into a rounded position, and that pec major brings the arm in towards the body. Now their paired set of muscles on the back of the body are the rhomboids. And again, we have a rhomboid major and a rhomboid minor. So these rhomboid muscles start at the spine, the thoracic region of the spine. The minor one is just a little piece at the top there that's running across from the spine to the shoulder blade. The rhomboid major is a larger fan of muscles. They have just a slightly distinct orientation, which is why they're categorized separately. But you can see that where they sit, if those rhomboids contract, they're going to pull the shoulder blade towards the spine. So again, that pinching the shoulder blades together at the back motion is dominated by the rhomboids, with those middle trapezius fibres helping out. So you can see that's the reverse movement to the pecs. The pecs draw the shoulders forwards, the rhomboids pull the shoulders back. So we want both those sets of muscles to have equal tone so that they hold the shoulder blade in a neutral position for your arm movement. If you're somebody that hangs out with round shoulders a lot of the time, typically your pec muscles are tight and your rhomboids are weak. Some other muscles that are key here are the levator scapular muscle. Now that's attaching at the top innermost portion of your shoulder blade, and it's swooping up into the neck and attaching to your neck vertebrae. So it's also a muscle of the neck. But again, if you shrug your shoulders up, levator means lifting, right? Elevating. scapula, the shoulder blade. So your levator-scapular muscle is lifting the shoulder blade up. So along with those upper trapezius fibers, it's helping to lift the shoulder blade up and shrug your shoulders essentially. Lower down, we have the latissimus dorsi muscle. We tend to call it the lats. Obviously, we have right and left versions of all these muscles. Now, the lats begin right down at the sacrum, the lower part of the spine, and attach all the way up the lower and middle part of the spine. And then the fibers fan across the whole of the back of the rib cage and attach into the upper arm. As you can see, the top part of that lat muscle is just swooping across the lower part of your shoulder blade, so it helps to stabilise that shoulder blade down. Then it comes across and attaches to the upper arm, and it helps to pull the arm to the body and actually rotates the upper arm inwards. So when we're doing arm movements, I often talk about the arm originating in the lower back. If we think of the wings that support our arm starting right down in that lower back, I'm really referring to this latissimus muscle, which along with the lower fibers of the trapezius muscle help to ground and stabilize our shoulder blade so that our arm movements can be free, but also we can use the strength of these much bigger muscles to take the weight when we're either lifting or weight bearing on the arms. Now, deeper muscles, and these are the more subtle muscles of shoulder movement, we have the rotator cuff muscles. They are a cuff of muscles that sit around the shoulder blade and the connection to the upper arm, and they help to stabilise that arm bone in the socket. Remember, that socket is not very deep, so we need these muscles to help those ligaments to stabilise the arm bone in the socket of the shoulder blade, but they're also going to help rotate that upper arm and move it around. So the rotator cuff muscles are also known as the sits muscles because their initials are SITS. Let's break these down a little bit. Now in this image we've got a front view and a back view of the shoulder blade, and we're going to start with that back view because that's where 3 of these 4 rotator cuff muscles sit. The top one is called the supraspinatus. Now remember, that ridge of bone that runs across horizontally the back of the shoulder blade is called the spine of the scapula. The supra, above, spinatus, is the muscle that sits above the spine of the scapula. So this is deep to your trapezius muscle. So if you could find that ridge on the back of your shoulder blade, press through the trapezius muscle, you'd be down onto the supraspinatus, and it runs across the top of the shoulder blade and it attaches onto the humerus, the arm bone. And its job is to lift the arm out to the side, and we call that abduction. So abducting, you take something away, and we'll look at that movement in a little more detail in a moment. Below the line of that spine of the scapula is the infraspinatus. Infra, below, spine of the scapula. And you can see that muscle kind of spans across most of the back of the surface of your shoulder blade, and it runs out and attaches to the back of the top of your arm. And its main job is to externally rotate the arm bone. That's a bit like turning out your thigh bone in dance class. You can rotate that arm bone in the socket, and that would be the job of the infraspinatus muscle. We then have a smaller little slip of a muscle just at the bottom of that infraspinatus, running in the same direction, and this is known as the teres minor muscle, and its main job is to adduct. That means adding inwards, so bringing that arm in towards the side of the body would be mainly the job of the teres minor muscle. Then going now to that anterior view, we have one muscle that sits on the front of the shoulder blade, and this is between the shoulder blade and the rib cage, and this is known as the beneath scapularis, the muscle that's underneath your shoulder blade. Its main job, as it runs across the whole surface of your scapula out to the inside part of your upper arm, it's going to rotate the upper arm inwards. So again, an internal rotator, which we would talk about as round-shouldered, right? So again, if you're round-shouldered, that pec minor might be tight, but also your subscapularis might be tight too. Those are the rotator cuff muscles. So now we have the crowning muscles, the muscles that form a cap over the top of this whole shoulder region, and these are called the deltoid muscles. I call them the t-shirt muscles because they form the shape of a t-shirt across the top of the shoulder region. While we collectively call them the deltoid muscles, they're actually made up of 3 distinct fibre groups, which are more dominant depending on which direction we're moving our arm. So if you're lifting your arm up towards the front, the anterior or red fibres here will be more dominant. If we're lifting our arm purely out to the side, those green middle fibres will be more dominant. And if we're lifting the arm to the back, the blue posterior fibres will be more dominant. But as a group, they lift our arm away from the body. Then finally, for our muscles, we've got the muscles of the upper arm. And these often people are familiar with, another paired set of muscles, the biceps and the triceps. Now, their correct anatomical name are the biceps and triceps brachii. The brachii refers to the arm because we also have biceps muscles and triceps muscles elsewhere. So the biceps femoris, for instance, if you've watched the hip video, is one of your hamstring muscles. Femoris, femur is your thigh bone, so that's the biceps of the thigh bone. Here we've got the biceps brachii, which refers to the arm. Bi means 2, so that means that this muscle splits into 2 bellies. It's called one muscle because at one end it has a singular attachment, and that would be down towards the elbow in this case. But at the upper end, this muscle divides into 2 heads, and we have a long head and a short head. The long head, seen in red here, runs up and it comes up and over the top of that arm bone, and it attaches into that glenoid cavity, the socket of the scapula, so it's crossing the whole of that shoulder joint. The short head comes up and attaches into the coracoid process. Remember that little bone that sticks forwards off the shoulder blade? So it attaches there along with the pec minor muscle. So the long head and the short head are both acting on that shoulder movement. Then the 2 heads combine and join across the elbow joint. So this muscle actually acts on the shoulder and the elbow, but we'll talk about the elbow action in the elbow video. On the other side of the upper arm, we have the paired muscle, the triceps. Tri means 3, so this one's got 3 muscle bellies. Again, it's one muscle down at the elbow, but up towards the upper arm, it splits into 3, only one head of which is the long head, crosses the shoulder joint. The other 2 heads, the lateral and the medial head, they just stay on the upper arm at the back and they don't actually act on the shoulder joint. The long head, however, comes up from the elbow and attaches onto the top edge just underneath the back of that deltoid muscle, the top edge of the shoulder blade, and so again it's active in moving the arm backwards away from the shoulder. Now, just some other structures to be mindful of. There's an area that we refer to as the thoracic outlet. The thorax is the chest, the sort of rib cage area. And at the top of it, we have this area where we've got the nerves that are coming from the neck. Remember that the nerves come out between each of your vertebrae. The ones that come from the neck bundle together and they dip under the collarbone, the clavicle that we found. along with a couple of blood vessels. So we've got an artery and a vein and a bundle of nerves that all pass between your collarbone and the upper ribs there. So if you're somebody that likes to have your shoulders up and you're a little tense in the shoulder area, when you raise your shoulders, you can actually close up that gap and it can start to pinch on the nerves and blood vessels. This can result in things like pins and needles or tingling in the hands. In extreme cases, you might find you get loss of blood flow to the hands and they start getting cold, or you might find that they start to feel weak and you lose your grip. Literally, you find it hard to grip and hard to bear weight on your hands and arms. If that's happening, it may be because we've got some impingement going on. These nerves and blood vessels also run underneath that pec minor muscle. Remember, that attaches onto that little process that sticks forwards from the shoulder. So they're bundled under there. If you're tight in that pec minor muscle, again, they might be getting squashed in that area and causing the same sort of symptoms. So if you're experiencing any of those things, you need to be mindful about your shoulder positioning. But I'll do a whole video on thoracic outlet syndrome, which is the condition that describes these symptoms. Lastly, we're just going to look at some shoulder motion. Let's see this thing in action. Now, we talked about the movement of abduction, where you take the arm away from the body, essentially lifting it up to the side. And that supraspinatus muscle is the one that initiates that. And we can see a lovely representation of it here. So we're looking front view at someone's right shoulder, and you can see that supraspinatus muscle coming from the back edge of the shoulder blade across to the arm. And you see that acromion process sitting there that's over the top, forming a roof to the tunnel where that muscle and tendon sit. Remember, we had that bursa in there as well. So this is an area that can get prone to impingement and inflammation if you're overusing that muscle, particularly in weight bearing or lifting activities. I also mentioned when talking about the joints of the shoulder that we have another one that's not really what we call a true joint, like the GH and the AC joint, but where the shoulder blade sits on the back of the rib cage, the thorax, it's articulating and gliding against the back of the rib cage when we move our arm around. So this we call the scapulothoracic joint. However, it's not a true joint because it's not attached by ligaments. There's no capsule around it. It's more of what we call an articulation, and we refer to that as a pseudo joint because it's not really a real joint. But what we can see here is the movement of that shoulder blade. As you lift your arm up to the side or in any direction, that shoulder blade needs to move and glide on the back of the ribs. You'll also notice that the clavicle, the collarbone, is having to move and articulate both at the sternum, at the chest, and also out at that acromion and AC joint. So we need to make sure we've got a good relationship between the shoulder blade and the back of the ribs in order to get good motion of the arm in space. And particularly when we look at weight bearing and lifting, we need all those big strong muscles around the shoulder to really anchor that shoulder blade down so that it doesn't wobble around too much and can provide a stable surface from which to operate. I'll do a whole video on stabilizing our shoulder blades for weight bearing and lifting movements. But now at least you've got a good understanding of the underlying anatomy so you can get the most out of these shoulder joints.